Hello, students. This is week 2. We've got the integumentary system that we're going to go over. Engage in ATI has 3 modules that you're going to complete, and so I'm going to make a lecture for each one of the modules. So if you want to watch my lecture first and then do that portion of the Engage series in ATI, you are welcome to do so. So let's go ahead and get started. So we have the integumentary system, and so this is Module 1, Structure and Function of the Integumentary System. Your skin, your integumentary system, it is the biggest organ. So he has won the biggest organ award. He is under a lot of stress. He is trying to keep it all together, and he carries a lot of weight. Specifically, 15% of your body weight is actually your skin. He likes to keep water in and keep water out. Think of it as waterproof. Your skin, students, is actually like a lipid-based layer. So think of how oil and water doesn't mix. And when you have water on your skin, it kind of bubbles up. It doesn't get absorbed in. Okay. So I want you to keep that in mind. This is a wonderful thing because that means you can go swim in the ocean and not overhydrate, right? You don't swell up when you go swimming because you don't absorb water through your skin. I also want to point out, students, you do not absorb salt through your skin either. Okay, so you can go swim in the ocean or swim in a swimming pool or take a shower. You don't absorb water that way, right? It doesn't get absorbed into your skin that way. It doesn't, when you go swim in the ocean or a saltwater pool, your body isn't absorbing that salt because you don't absorb salt through your skin, right? So that means your sodium levels don't get all messed up. And I point that out because sometimes people like to sell things. Epsom salt. They have a great marketing team. You can soak in all the Epsom salt that you want, but it is not going to absorb into your skin, and it's not going to do anything for a sprained muscle or a sprained joint or anything like that. It may make you smell better, and it may like soften your skin and make it feel nice, but it isn't going to do anything. Like, you don't absorb it systemically. By law, Epsom salt can only put that you can take it as a laxative. They're not legally able to put on there that it is a cure for like sprained joints or infections or anything like that. They're not supposed to anyway. Alrighty, so we are looking at the skin. So we have got our subcutaneous layer, that is our fat. We have got our dermis, that's our biggest, our a big portion. It's got hair follicles and blood vessels and nerve endings. And then we have our epidermis. And I want to point out there are lipid bilayers in here. So it's got some fatty layer here to the outside. So that's important. I want you to remember back to chemistry, like dissolves like. Okay, so like we have this saline solution and this sugar water. They are both water based. So if I pour them like, one into each other, they'll dissolve and dilute and they'll mix and like dissolves like they're both water based, so they'll dissolve into each other. My other example here is vegetable oil and essential oils. Those are both oil based. So you can mix those into each other. They have the same base, like dissolves like. So you can, whether it be cooking oil or coconut oil or some sort of essential oil, you can mix those into each other, like dissolves like. And you should know by now, students, that you can't mix vegetable oil and water together. Those don't they don't dissolve into each other. They don't mix. And so why is this important? Why am I bringing that up? Because you need to know this for pharmacology. So if you are applying a topical drug to your patient, it has to be lipid based. So any creams, ointment, medication patches, essential oils, it has to be lipid based for your skin to be able to absorb it. Okay? There are 3 layers of your skin. We kind of touched on this a little bit: epidermis, dermis, and subcutaneous layer. Think epi. Epi means upon, on, above, over. Where do you put an EpiPen? You don't swallow it, you put it on the outside of your skin. So remember, epi means on the outside, dermis means skin, subcutaneous means below, underneath. Think of it as the basement level of your skin. Okay. So our stratum basal, this is a portion of our epidermis. This is your basement of the epidermis. It reproduces constantly, makes keratin, makes melanocytes. Your melanocytes do secrete something called melanin granules, and then they come over here to the keratin cell, and they form a protective layer on the outside of it to help protect the nuclei from damage from the sun. Some of us naturally have more protection to the sun. We have more melanin in our skin. Those people, I swear, are just happier on the beach because they've got that natural layer of protection and all that beautiful melanin, and they can go out there and be happy in the sun. And then some of us avoid the sun because it hurts. Vitamin D, this is your sunshine vitamin. It is processed through UV exposure. Okay, so we got to get the sun in order to get our vitamin D or take a vitamin. Light skin does process it faster. So look at your patients here. This fella, he is going to get a lot more UV rays into his skin. So he is going to process vitamin D in about 15 minutes for what he needs total. And this beautiful lady is going to take about 3 hours because she has more of that natural tan. I want you to understand this though, students, because vitamin D is essential. Okay, we need to have vitamin D in order to be healthy. We need it for calcium absorption. It is actually a component in our immune system. It makes our white blood cells work better. Low vitamin D can also cause chronic pain. Also in your skin, you have macrophages, but we like to call things different things in different places. So your macrophages, which are your piggies, your macro means big, phage means pig. These are your big pigs, right? They eat and eat and eat until they blow up. Your little piggies that are in your skin, they are called Langerhans cells, and they eat they are macrophages, so they eat pathogens and then they present them to the T cells to say, hey, look what I found. You got your epidermis here. Again, your melanocytes. I want you to understand that the melanin granules are secreted from that, and then they go over to the keratin cells. Um, you have extra nerve cells called Merkel cells in certain areas of your body. So, like your palms, and I think you know by now that your palms and your fingertips are more sensitive than what your arm is. The bottom of your feet are more sensitive. You have certain areas of your body that are more sensitive. It's because you have Merkel cells there. Your dermis layer has got collagen fibers, elastic strands, and sebaceous glands. Those are your three big players in the dermis. Your sebaceous glands, they secrete sebaceous fluid, collagen fibers, and elastic strands. Think of that as like elastic that is kind of like holding everything together, holding it in shape, helps you have good turgor. Okay, so when I pull this up, it goes back to where it's supposed to be. Okay, so loose connective tissue. So you got your areolar tissue that has collagen fibers and elastic fibers, loose connective tissue that contains collagen and elastic fibers. And then your adipose tissue, that is your subcutaneous layer, it's your fat. All right, so let's talk about some glands here. We've got our sebaceous glands, which secrete oil, um, eccrine glands that secrete sweat, apocrine glands, which are, I call them smelly glands, and your mammary glands. So we'll start off here with our sebaceous glands. So we've got our sebaceous glands here. That is what makes your hair oily, and especially around puberty, this is what causes acne. Your, I don't know exactly the pronunciation of this. I think it's esserine glands. Those are your sweat glands. So some people, when they go to get a blood draw, they get really sweaty. And then Lord knows when I'm outside in the sun, I get sweaty. Apocrine glands, these don't really kick in until puberty. We've got these two fellas here. Who do you think smells a lot better? This cute little booger right here. He is just a cute little guy. Babies smell good. Teenagers stink. If you've ever been in a in a locker room, you understand that. And then we have breast tissue here, normal breast tissue, but just know that sometimes you can get inflammation in the mammary glands, and that is called mastitis. Okay. All right, so your function of the skin. We talked a little bit about this. It's to keep water in, keep germs out, and keep heat in. So we try to keep fluid balance, and it is our big player when it comes to the immune system. It's our biggest organ, tries to keep a bunch of stuff out, and then it's also really important in thermal regulation. The skin cell, they reproduce really fast. So you get new skin cells made all the time. They are produced in the stratum basal and they work their way out, and you shed old skin cells. They come from uh, this derm or this stem layer, your ectoderm. So remember, we have three germ layers. We have our endoderm, mesoderm, and ectoderm. These are our somatic stem cells. So Embryonic embryonic stem cells, those have absolutely no differentiation and those can become anything. And then you have your somatic stem cells, which are from your three germ layers, which can still grow up and choose to be different things, but there's like lists of those three things that they can grow up to be. So the derm layer comes from the ectoderm, and these are things that it makes. So skin, hair, nails, sweat glands. It also makes your nervous system, parts of your eyes, ears, tooth enamel. All right, so those skin cells, they reproduce here in the stratum basal and they work their way up all the way. So they make keratin and they release lipids that fill the tiny spaces in between the cells. So our stratum basal is making these keratin cells, they're pushing them out, but it's also making some lipid that kind of seals it all together. Think of your keratin cells as bricks, and then the lipid that it's also making, think of it as like mortar. So things are nice and neat and tightly packed together and lipid soluble. A protective shield is formed. We've got our melanin. We talked about this again. It secretes those melanin granules. It protects from UV rays. So, less UV damage, which can cause, other problems like skin cancer, but higher risk of low vitamin D levels. Temperature regulation. So, how the skin cools the body. So, what happens when you get really hot is your blood vessels get really big, they swell up, they get kind of closer to the surface here so they can dissipate more heat, and then you also sweat. And students, by now, at some point in your life, you have stepped out of the shower or gone swimming. And when you get out of that water and you have water all over your skin, you're cold, right? So, water on your skin helps evaporate heat. That's why you sweat. So, you evaporate more heat. So, keep that in mind as the nurse when you're taking care of your patient and you're assisting them in the shower or you're giving them a bed bath or whatever care that you happen to be providing. Know that you may be really hot and in that shower room, giving your patient a shower and you're sweating, but your patient's wet. They have water all over their body, so they are going to get cold a whole lot more quickly. And if you are caring for somebody who's older, their skin is going to be a lot thinner. They don't have the good temperature regulation that you have, so your patient's going to get really cold. So please be aware of that and sensitive to that. All right. So when you are, so we talked about being hot, and when you are cold, you have vasoconstriction. So then it holds more blood closer to your body. Okay. So we want to conserve that heat. And then another thing that happens, you have these little erector pili muscles that will constrict, and it will cause you to have goosebumps. The hair on your arms will stand up. And when you get goosebumps, students, so you have the contracture from the erector pili muscles, and then it pops up your little hair follicles, and it causes your hair to kind of get like this little layer of air, kind of a barrier to the outside of your skin. So it's like a little air blanket. So it so with temperature regulation, you have vasodilation to dissipate heat and sweat to dissipate heat. You have vasoconstriction so that the blood shunts more to the core portion of your body where all the important parts and pieces are, like your organs. And then it also causes goosebumps. So those little muscle contractions happen with the erector pili muscles, and then you get that little air blanket on your skin. All right, repair. Step one, stop the bleeding. Okay, when you have an accident or some sort of injury, first and foremost, we should have you not bleed to death. So stop the bleeding. We need to constrict those blood vessels, and we need platelets. We're going to talk more about platelets when we get into the section where we actually talk about the blood system, and we talk about all the different cells. But suffice it to say, for this chapter, I want you to know that you have uh, cells in your bloodstreams called platelets, and those are very important when it comes to stopping bleeding. Okay. All right, so once we stop the bleeding, we have the inflammatory phase, the proliferative phase, and then the remodeling phase. So the inflammatory phase, and we've kind of already talked about this in last week's lecture, we have an immune response. There is an activation phase. It's an inflammatory response. You get immune cells there, inflammatory markers, uh, cells, they get there and start saying, hey, there's a problem. The proliferative phase, if you remember from last week, that is when cells make more cells and reproduce and reproduce. And then remodeling phase, that is when things get a lot more organized and it's kind of like the final touches. Think of remodeling your house, like we're, almost done remodeling a room. There is a really good video in ATI that I make sure you watch this. There's one on wound healing. Make sure and watch that. All right, your skin is the first line of defense. So, on your skin, you have sebaceous glands. So, you have your sebaceous glands, and it's secreting something called sebum. So, you have like this oily stuff on your skin, right? Right. You have oil on your skin. You have oil in your hair, you have oil on your skin. Okay. And by having that on there, that kind of helps kind of wash away things that we don't want on there, pathogens. Okay. Your skin is also slightly acidic. So that too also is a defensive mechanism with your immune system. So you have oil on your skin that helps keep pathogens away. You have acid on your skin that helps keep pathogens away. You've got your little Langerhans piggy cells that are in here that are munching up on pathogens should things get in there. If there is a breach in the epidermis, then your little piggy Langerhans cells, macrophages, they go and eat and eat and eat until they blow up. And when they do so, they do it in the lymph nodes, showing the T cells, hey, look at this thing that I found. Also, when there is a breach, you have an inflammatory response. Your cytokines, these are proteins that coordinate the inflammatory response. They get white blood cells to the scene. They kind of coordinate the show. Sometimes your immune system misbehaves and it has a reaction when it really shouldn't be having a reaction. So that could be like a reaction to poison ivy weed, that could be a reaction to a lotion you're possibly allergic to. Like my skin shouldn't overreact to this, but sometimes it just does because it misbehaves. When something is itchy, what we call it pruritus because we have to have fancy names for things. So if you see that, that just means itchy. Hypersensitivity reactions. There's different types of hypersensitivity reactions, and we will go over this further when we go into the immune system module in ATI. Hypersensitivity reactions. Suffice it to say, for this week, you have to understand that hypersensitivity type 1 reactions are the worst. And I want you to, this is how I always teach my students IgE. If you have an IgE mediated reaction, that means there's an emergency, you need an EpiPen, and you go to ER. If you have an IgM mediated response, that just means you just met. So your inflammatory reactions are just starting. IgG means you are good to go. So you have antibodies already ready. But this week, type 1 hypersensitivity reactions are the worst. So what happens in a type 1 hypersensitivity reaction? Your allergens, they kind of bind onto this mast cell and then you have rapid degranulation. So this mast cell kind of pukes out a whole bunch of histamine and it gets all over the place. It happens fast. It releases histamine and leukotrienes. Blood vessels increase. You have vasodilation. Capillary vessels, they get really big. So, what's the difference between a normal allergic reaction and anaphylaxis? Think of it this way: a normal allergy reaction, it's just a campfire. So something's on fire, but you can take an antihistamine like Claritin or Zyrtec. Maybe you need to take some Singulair along with it that inhibits leukotrienes, and you can just take some medicine and be better. But if you have anaphylaxis, it's huge fire, everything's burning, and that's why you need epinephrine, an EpiPen, IV epinephrine, get to the ER, and then we will give more medications. We will also give an antihistamine. In addition to that epinephrine, we will also give a steroid. So your three stages of your immune reaction or your inflammatory response is alarm, resistance, and exhaustion. We went over that last week. Sometimes when you have a constant irritation or pollution on your skin, that will cause the skin to break down and cause chronic inflammation. Nurses get this a lot because we are frequently washing our hands. So a lot of us will have contact dermatitis on our skin or some breakdown. So moisture is really important in the wintertime to help kind of replace those lipids that are getting lost from constant washing of our hands. But we don't want to give our patients an infection. So we are going to continue to wash our hands a whole lot. Also understand students, when you get older, things don't work like they used to. So we've got our young skin here that has healthy looking cells, has really good elastin, has good skin turgor, and older skin, well, things shrink, they get thin, and things aren't as stretchy and pliable as they used to be. When you start learning your assessments, you're going to learn something called your skin turgor test. That is testing elasticity, and we use it as a test for hydration with skin. A lot of the textbooks will show you to check turgor by pulling up on the hand. That's not really a good place to do that with your older individuals because they've lost so much of the collagen and elastin. Usually I'll kind of pull up right here. When you tent the skin, it should go back down where it's supposed to be. If you have somebody who's young and has normal elastin, and you pull up their skin here or here and then it stays up, it's called tenting. That's bad. That means they're really dehydrated. Uh, when you are charting, you want to chart smart and say the right things. Okay. When you're charting your assessment as the nurse, you don't want to be like, oh, they had a red spot on their hand, or they had a boo boo on their elbow. Okay. You have to be smart to be a nurse, chart that way. So use the proper terminology. A macule is a flat spot, so think of a freckle. Papule is raised. You can actually palpate it. It's an elevated bump. Think of a pimple before there's like pus in there. So we've got a freckle, we've got mild acne, skin conditions. So patch versus nodule. Patch, okay, have you ever seen like a patch on like a vest? I used to have a Girl Scout troop and we used to have patches. So a patch is flat, but it's an area that's different. So think of that on your skin. You have a patch that's different, but it's not raised a whole lot. A nodule that is definitely firmer and you can palpate it more so. A tumor is a tumor. A skin plaque, think psoriasis, and we're going to go over this more in the next lecture of what a skin plaque or psoriasis is. We're going to delve into that a little bit more. A vesicle and a bulla, they are the same thing, but vesicles are small, fluid-filled blisters, so just like half a centimeter or less. They're little guys. And a bulla, they are bigger than half a centimeter. So some examples, because examples help us learn. Uh, so herpes would be like a cluster of vesicles, and a sunburn would be big old blisters. So that would be more of your bulla. Bulla's blisters. Skin reaction comparison. So a pustule versus wheal. A pustule has pus, so that should be pretty easy to remember. A wheal, this doesn't really have like any squishy fluid in it, but that would be swelling. So like a wheal would be an allergic reaction where you have hives, so it's like swelled up, but it's not anything like squishy that you could pop. Secondary lesions. So these are secondary to something. So we have excoriation. So sometimes somebody is itchy and they started off having some hives or some wheals, and now they have scratched and scratched and scratched and scratched, and they have excoriated themselves. Fissures. Think of fissures are little cracks in the skin. Okay. And you can get that, yeast will cause it. So sometimes we get yeast infections under breasts. You can get them in the groin. People can actually get yeast infections in their mouth, and they'll get little fissures in the corners of their mouth. So fissures are little cracks, usually caused by yeast. Calluses, you guys know what calluses are, but the medical term for it is crust. So that would be anywhere you can get a callus. That's a buildup of keratin. That can be on your hands if you work, with like your farmers. They work with their hands a lot. They have a lot of calluses on their hands. Somebody who does road construction or any type of construction, they might have calluses on their knees. So we'll say they have crusts on their knees. People who walk barefoot in the summertime over gravel, they're going to have calluses on their feet. So we say they have crusts on their feet. Some more terms that you need to know for your assessments. Pallor is pale. Jaundice is yellow. Do not chart that they have yellow jaundice, because now you've basically said the same thing twice. You've So if you document that my patient has yellow jaundice, you've basically said my patient has yellow yellow. Don't do that. They're jaundice or they're not. And cyanosis, cyan means blue, so that means that they're blue in color. So your job as the nurse, you need to assess skin thoroughly, look for breakdown of the skin, understand that this is a portal for infection. If you have breakdown in the skin, your patient can get an infection, and it's also a cause for fluid loss. You want to plan your care appropriately. So patients, or understand with your patients, when you're the nurse, if your patient has burns, then they've got sections of their skin that are not working correctly. They're burn patients, they lose a lot of fluid. They are at high risk for dehydration. Patients who have surgery, okay, they've got an abdominal incision. Think of it I mean, probably a lot of you haven't been in a surgical suite, but when your patient has like a belly surgery and their skin has been opened, okay, all that evaporation has been happening that entire duration of their surgery. So when your patients come back from surgery, you really have to watch their intake and output, because high risk for dehydration because they've evaporated so much fluid while they've been in surgery, plus the blood loss. So they've got blood loss and evaporation. So you as the nurse needs to understand that. Plan your care appropriately. So you're going to document your findings. You're going to reposition your patient to prevent injuries, prevent pressure injuries. So we take care of a lot of patients who are sick, and sometimes they are so sick that they can't turn themselves over. When they lay in one position all the time, especially for more than 2 hours, they are at a higher risk for getting breakdown and kind of excoriation and erosion in certain areas, especially bony areas. So you want to reposition your patient and do skin checks. Excuse me. Sometimes they're hooked up to a lot of things, and uh, you know if they're on in intensive care and they've got a blood pressure cuff on their arm that is checking their blood pressure every 15 minutes, sometimes it's a good idea to open up that blood pressure cuff, kind of reposition it and put it back on so it doesn't cause pressure sores to their arm and skin breakdown, because we don't want them to get an infection. Change dressings and briefs regularly to prevent excoriation. I'm sure a lot of you at some point have babysat in your life. You understand that you have to change diapers on a regular basis, because if that fluid is constantly hitting that baby's skin, it's going to cause breakdown. No different for adults. If you constantly have a wet dressing on somebody or a wet adult brief, it's going to break down that skin, which we don't want. And I know it seems so simple, but bathing your patient reduces the risk for infection. Students, our patients in the hospitals have things that are open and broke down that they normally don't. They have a surgical site. A lot of them, they'll have an IV. Sometimes they'll have a catheter put in. A urinary catheter. So they have these open areas already on their skin that they normally don't have. And then second, the hospital has a lot of germs. So they're in an environment that has more germs and they have more breakdown to their skin. So by simply giving your patient a bath every day and wiping them down, you're reducing the microbe count on their skin, which will help reduce the risk of them getting a hospital infection. So, which is a good thing. We don't want people to get an infection. So, well, that is our first lecture over the first module. Hopefully, this will help you move through your ATI module a little bit easier. And if you have any questions, just email me. Thank you.